Here we are in general anatomy and physiology looking at the urinary system. Here we see the abdominal pelvic cavity, and inside we can see the urinary anatomy against that posterior abdominal wall. Now typically the kidneys are going to be covered by what we call the fat capsule, so a very thick layer of fat covering them, protecting them, and holding them in position. Now with the fat capsule removed, we can see the adrenal gland, we can see the renal artery and vein connecting to this indent known as the renal hilus. Now this brown layer covering the kidney directly is known as the renal capsule. Now from the kidney coming out of the hilus, we can see the ureters coming down, and these would be traveling down here to the bladder. We can see that a little bit more clearly on this model. All right, so again, here's the ureters. Now the ureters are capable of peristalsis. They are going to push the urine into the bladder. And so as the bladder expands and fills, the tension in here does not prevent the urine from continuing to fill it. Now, the bladder is our storage area. It holds approximately 500 milliliters. It is under the influence of the parasympathetic nervous system, and the part of the brain that initiates bladder contractions is the pons. Now, the muscle here is called the detrusor muscle. It is a smooth muscle, and lining the bladder, we see transitional epithelium. Now, when the bladder is empty, the transitional epithelium forms these ridges known as the rugae. Now, the urethra is what carries the urine out of the bladder, and the area that we see here between the urethra and the two ureters, this area is known as the trigone. Now, the trigone is the most commonly infected area due to E. coli bacteria coming in through the urethra. Now, the male urethra is much longer than a female. It has to go through the prostate gland. It also has to go through the penile structures, specifically the corpus spongiosum. So the male urethra is around 20 centimeters long. If we contrast that with the female urethra, the female is only 3 to 4 centimeters long. Now here we can see the female anatomy. Again, detrusor muscle, transitional epithelium. You can see part of the trigone in here, and then the urethra. Now as the urethra comes down, it's going to go through the area known as the perineum, and the muscle that transverses here is known as the urogenital diaphragm. Now, part of that urogenital diaphragm is the external urethral sphincter that we see here wrapping around the end of the urethra. We can see that as well here on the male. Okay, so again, here's the perineum, and then the urogenital diaphragm, which is transversing the perineum, and this right here is the external urethral sphincter. Now, that sphincter is skeletal muscle, which then gives us the ability to regulate micturition. Now, when we look at the internal structures here on the kidney, okay, so again, this dark area, that's the capsule again. And then on the inside, we see the outer region known as the cortex, and then the inner region known as the medulla. Now, the medulla is characterized by the renal pyramids that we see here. Now, the pyramids are surrounded by some specific blood vessels that you want to pay attention to. Now, between the pyramids, this is what we call the interlobar artery and vein. Okay, now they are going to give rise to the ones that go across the base, called the arcuate artery and vein. Now, the arcuate artery and vein run horizontal with the cortex, and so they separate the medulla from the cortex. Now, from the arcuates, we see these little guys coming out. These are the cortical radiates radiating into the cortex, right? Now, out here in the cortex, this is where we find our nephrons. So the nephrons are the smallest functional units in the kidneys. You have approximately 1 million nephrons in each kidney. Now, here we can see the arcuate artery and vein going across. We can see the cortical radiates running vertically again into the cortex. So this area is the cortex, this area is medulla. Now, from the cortical radiate, we see a little blood vessel coming off known as the afferent arteriole, which leads to a first capillary bed known as the glomerulus. Now, the glomerulus is where we see filtration. Now, from the glomerulus, we see another arteriole known as the efferent arteriole, which gives us a second capillary bed known as the peritubular capillaries. So these are the peritubular capillaries over here, and these are where we will reabsorb all the essential nutrients and water from our filtrate. Now, filtrate comes out of the glomerulus and into this structure here known as the Bowman's capsule. So the Bowman's capsule collects the filtrate. It then proceeds down this structure known as the proximal convoluted tubule. This area is where we will absorb most of our nutrients and water and put it back into our peritubular capillaries. Now, as the proximal convoluted tubule twists and turns, it's going to go down into the medulla, forming the loop of Henle. So here's our loop of Henle. This part is descending. This part here is ascending. Now, the loop of Henle is where we will absorb some water and sodium. Now, as it goes above the arcuate artery and vein into the cortex again, we change names. We call this the distal convoluted tubule. So this will twist and turn back and forth, but it will always run right next to the afferent arteriole before attaching to this large structure here known as the collecting duct. Now, the distal convoluted tubule may be where we will absorb some water and sodium. It's also where we will excrete wastes into the filtrate, which will then end up in the collecting duct, and then we call that fluid urine. So urine is first seen in the collecting duct here. Now, as urine travels down the collecting duct, it's going to come out the tip of the pyramid here, which is referred to as the papillae. Okay, so here's a pyramid. Okay, so here's that tip. There's the papillae. That's where the collecting duct will empty, and urine is going to come out here and into this first structure known as the minor calyx. So each papillae is surrounded by its very own minor calyx. Now, these minor ones might join together to form what we call a major calyx, but then we are going to see this funnel. Okay, so this funnel-like structure right here is what we refer to as the renal pelvis, and the pelvis will bring the urine out and then into the ureter, which then travels down to the bladder. Now, if we look a little bit more closely at the glomerulus, okay, so here's the glomerular capillaries. Now we're going to notice that the glomerulus is covered by special cells here known as the podocytes. Now the podocytes are epithelial cells which cover the glomerulus and reinforce it to prevent it from rupturing under a very high filtration pressure. Now this side, the right side here has been exposed. The left side is still covered by podocytes. This right here, however, is the glomerulus as it sits in the body. This large structure again is the Bowman's capsule, and then down here we see the beginning of the proximal convoluted tubule. Now when you notice here, you look at the cells of the proximal convoluted tubule have microvilli, which help them to reabsorb nutrients from the filtrate. Now, this is the afferent arteriole. Lining the afferent arteriole, we have some cells in here known as the JG cells. Right, these JG cells are going to be important in helping regulate blood pressure through a system known as the RAS. They release a hormone known as renin. Now this right here is the distal convoluted tubule. Like I mentioned earlier, the DCT will always wrap around and come against or abut the afferent arteriole. The reason for this is that the macula densa cells that line this area of the distal convoluted tubule help to regulate filtration through the afferent arteriole. They release chemicals which will either dilate or constrict the afferent arteriole, changing how fast filtration occurs. Okay, so those macula densa cells are just these tall cells, these columnar cells right here along the edge between the distal convoluted tubule and the afferent arteriole. That is it for the anatomy here in the general anatomy and physiology classes.